Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Forensic Medicine and today we'll discuss about electrical injuries. In this we'll discuss about injuries caused when the high current passes through the body. Electrical injuries are relatively common, complex and potentially devastating from form of trauma, which are seen both in the industry and as well as domestic circumstances. The manifestation of these injuries may range from transient unpleasant sensation when low voltage current is passes or low amps current is passed to instantaneous death where when the high voltage current is passed through the body. Unlike thermal burns, electrical injuries are commonly involve multiple body systems. So unlike thermal burns where the burns are usually seen in the one part of the body, in electrical injuries has current passed through the body, there are multiple part of the bodies involved. There are various factors which influence the injuries and severity of injuries depends on different factors. One is the kind of current. So as we know, there are two types of current, that is alternate current and DC current, that is direct current. Alternate current, which is used in the common household useful, which is more 4 to 5 times more dangerous compared to direct current. Direct current is usually found in the batteries are and these injuries are uncommon, occurs in case of lightning injuries and from contact with certain equipments. At low amps of current, AC causes like tetany where there is contraction of muscles. Usually the flexor muscles are involved, which leads to contraction of hand and forearm, and the person is unable to release the device until the power is turned off, which is commonly seen in AC current when the person is holding a live current because of at low amps, which it causes flexion of the muscles, and the person will be continuously holding the hand until the device is turned off. It also interferes with normal cardiac pacing. It may alter the sinus rhythm of heart, leading to cardiac arrest. Next factor is the amount of current passage. So the current is usually expressed by Ohm's law as I is equal to V by R, where I is the current, V is the volts, and R is the resistance. So I is directly proportional to volts. So if the voltage of current is more, the current amps of current will be more, and if the resistance is more, then the current will be decreasing. So the current, if it is flown through a medium where resistance is more, then the amps will be decreased, and if the volt is more, then the amps will be more. So volt is nothing but the pressure, type of pressure where which the charge of current passes through the wire or in the body. The flow is great if voltage is high and resistance is low. Usually electrocution is very rare below 100, less than 100 volts, and usually that occurs at more than 200 volts of electricity. Amps of current is more important as it indicates the actual intensity or amount of electricity which passes through the body. So amps of current is nothing but the amount of charge which flows to the certain part of the wire at that's given time. So it is the part which causes more damage compared to volt, by which the current passes with the difference, potential difference. Next factor which influences the injuries is the path of current. Death occurs mainly more likely when it passes through some important organs like brain stem or heart. So to current to flow, it has to always to be remembered that there should be a one part where the person is holding some live wire, and one more part where the person is holding where the person may be holding some other wire or negative part. So always the current flows from positive to negative, and at the part where the person is either he has to be holding another part of the negative part of the wire, or he may be touching some ground or earth, which acts like a huge potential difference, and which acts as like actual negative actual ground, which may act as a conductor to carry the current. So two part has to be present in any electric current to complete the circuit. So if the person is holding one hand in the live wire, one more hand is touching the ground or some other conductor of negative, then the current will flow from one hand to another hand, and it may pass to heart, causing to cardiac arrest. Similarly, if the person is holding in one hand live wire, and if the person is touching the ground, then it may flow from hand to heart to the ground to the foot. And if the person is standing and there is a live wire on the head, it may pass from the head and it may go to the hand if the person is touching some live wire. And if the person is standing on some live wire, it may pass from ground to head, some similar to that. So it has to be remembered that to current to flow, there has to be some two-way. Where there is should be a potential difference where the current can flow. Next factor is the duration of current flow, which is directly proportional to how much duration the person is holding the current. If the person is holding the current for more duration, the damage will be more. Next is resistance. So usually the body offers huge resistance, the skin offers a huge greater resistance compared to the electrolytic fluid which is present in the inside the electrolytic fluid, and the blood which offers less resistance. So the skin which offers greater resistance gets burned up, and when the skin gets burned up, it passes through the electrolyte and it has a clear resistance is decreases and it can pass easily. So the greater the resistance, the more likely the burns will result. Dry skin offers higher resistance, that is 1000 to 1500 ohms, but resistance decreases when the skin is moist and covered with sweat, which decreases to 200 300 ohms. And if the skin there is some injury is present, and if there is some extracellular fluid is present, then the current can pass easily because of the injury. Next is site of contact. If the part of the body which comes to contact is has a layer is the skin is very loose, like in face or arms, then the injuries is more comparatively to the palms which has a thick skins. Next, now coming to effects of injury, effects of electricity. Effect Electric injury can cause fatal electrocutions, electric shock, and burns. And these are usually divided into low tension injuries and high tension injuries. Low tension injuries include skin burns resulting from heating of the tissues. So as the current flows through the body, it along the path, it causes the skin to heat up and the skin may get burned along the path of current. Most common sites of low voltage current injuries are the entry wounds or the hands. So as we mentioned that any injury, electric injury has to occur, there should be some part of entry and one part should be exit. And if the person is holding on the one hand and if there is a ground, then the entry one will be commonly is the hand where the person touching the live wire, and then the exit wound may be present in the opposite hand or it may be present in the foot, which is the exit wound. The high tension injuries usually occurs when there is a high voltage of current is passes, that is 1000 volts of current are passing. So injuries are caused by three sources, like it can cause flash burns, flames, or current itself can cause injuries. The burns may be of severe injury, severe type may cause third degree burns, which may similar to third degree burns, that is skin, more the dermis, epidermis, dermis, and muscle layer may include. And there may be charring of the body may also occur. There can be massive destruction of tissue with loss of extremities and rupture of organs may occur in high tension injuries. Characteristic of injuries in electrical injury, which can be divided into local and systemic effects. Locally, it can cause burns. Systemic effects are usually on the organs. Local effects are usually caused because current passes through the skin. It produces heat and boiling, and skin exports and roll back the surface. So, as the current passes through the skin, at the part of contact, it becomes there is a depression and there is a puckering of the skin occurs because of the boiling of the electrolytic fluid. So there are three types of common burns are seen. One is called as electric mark or jowl burns. Then there is flash burns. Then there is electric burns and splits. Coming to one by one. Electric mark, the jowl burn. This is the entry wound when the person is holding the live wire. This is also called as jowl burns. These are typically seen when the person is holding some live current is present. This is characteristic seen as puckering of the skin. So there is a puckering of the skin. If you see in the frontally, there is a central depression will be present, and along the edges there is elevated skin will be elevated. That will be seen around the edges. There will be the areola will of the pellar will be present. So at the center part there is a injury will be present, but around the area there will be pellar will be present. There is no red line compare like a burns. In burns there is erythema, but in this type of burns there is no erythema. There is no reddening will be seen at the entry or as well as exit wound. The crater floor is lined by pale flattened skin. So The crater, that center part will be pale. There is no like flattened skin will present. The sometimes blisters may be found. So it is fluid filled skin will be formed, which may get settled down after few minutes, which is produced by heating of the tissues by the electric current, which is called as endogenous burns. When the contact is more prolonged, skin may become brown. With further contact, there may be charring, that is blackening may also occur. If you observe microscopically, the epidermis shows Swiss cheese appearance, that is multiple vacuolations are seen in the tissue. There is vacuolation of epidermis and dermis. There is epidermal blistering will be present, nuclear streaming, elongation of epidermal cells will be elongated, nuclear vacuolation will be present, plus there may be eosinophilia of dermal collagen will be also seen. The nuclei are thin, elongated, and lie parallel to each other. So Swiss cheese appearance is mainly because of electrolytes fluid which is present in the skin gets steamed up and they burnt up and lead to vacuolization will be present. Exit wounds. So exit wounds typically look like an entry wound only. They vary. There is appearance variable, but some features are those of entry mark. They are seen as splits in the skin. The skin will usually the skin gets splits up. Though sometimes may look like an entry wound. Sometimes the skin may get split up. It will look like a lacerated wound where skin has been raised into edges of the passage of current. In high voltage current, the exit often appears as blowout type of wound. So usually it looks like entry wound, but exit wound sometimes the skin may get split up and it may cause blowout injury, blowout type of injury. Now coming to flash or spark burns. So this occurs when there is high voltage current are seen. When the occurs when contact is less firm, and the current jumps from the air gap exists between the skin and the conductor has a spark. So here the person may not be holding the current. There is a live wire. The person may be just standing, or there may be just he is just in close contact with the current, and at the point of current at the contact, the because of high voltage, the current may just flash jump between the air and the skin, leading to the flash burns. So as the current passes, it causes the keratin to melt over the small area. At the point of contact, the keratin becomes melted up on cooling. This keratin fuses to hard brownish nodule, usually raised above the surrounding surface, which is called as a flash or spark burn. So the contact, because of melting of the keratin, there is the keratin will be raised, the melted, and as a nodule, the nodule will be formed, which is called as a flash burns, which occurs in the high voltage type of current. Sometimes in high voltage currents, multiple burned or punched out lesions are produced due to arcing, dancing over the body surface over large area. So similarly, sometimes if the because of high voltage current, the current may not just form flash burns, it may arc over the skin, and multiple flash burns may be present, leading to which is called as the crocodile flash burns. In case of closely and elliptical flash, in case of face, there may be singeing of eyelashes along with first degree burns of the skin of the face, which is called as arc eye. High amps of current has an explosive blast-like effect and may produce injuries resembling bullet, stab, or incised wound. Sometimes, as I mentioned, so high voltage current may cause intense puckering of the skin, leading which may look like a stab wound or incised wound or a bullet wound. So, if the voltage is high enough, it may cause the skin to pucker up and it may look like a burn or a stab wound. So this is local effect where the contact is present, close contact. There is pale area is formed and the skin is raised up because of the burning and steaming of the fluid inside the electric fluid. And so if the contact is not close contact, and if the voltage is high enough, it can cause spark and leading to nodule will be formed on the skin. That is flash burns. Third type of characteristic burn which is seen is the Iatic burns or splits. These are lacerated wounds, sometimes punctured with contusion of the margins. In some instances, in this type of injury, there is if the person is holding the wire which is holding may melted up. This molten metal derived from the metal of the contacting electrode may be carried into deep tissues, forming a small balls called as current pulse. So the part of the wire he is holding may get melted and may get deposited in the tissue as a small balls, typically called as current pulse. Sometimes if the person is holding some live wire and there is a contact which is present with his, contact with his high voltage current is present, then the current may melt the calcium phosphate present in the bones, and in if you take the X-ray of that limb, it may show round dense foci known as bone pulse or wax dippings. So it will look like a wax deposition which may be present on the along the bone walls. So if you observe wax formed on the candle, it may look similar to that, which called as the bone pulse. So this is caused because of melting of the calcium phosphate. Now coming to systemic effects of electrical injury. So local effects usually causes the electrical mark, that is jowl burns, then flash burns and the electrical burn splits. So systemically, when the current passes through the body, it may cause immediate death from the shock of the pain and the shock. Then on CNS, if the current passes through the brain, it may cause hemiplegia or paraplegia, aphasia, if there is unable to talk, headache, vertigo, convulsions. In eye, it may cause cataract. If it passes through the eyes, it may cause cataract, optic atrophy, chorioretinitis may also occur. Sometimes there is pulseless, hypotensive, loss of responsive to external stimuli, coldness, cyanotic, without respiration, suspended animation like state may occur. So, like a suspended animation state may occur in which the person is pulseless, hypotensive, person is unable to respond to any stimuli, the person will be cold and cyanotic. So, this is called as which is a characteristic condition of a suspended animation where the person may do alive, but all the features look like a person is dead. So, these are all systemic effects of electrical injury. Now, coming to cause of death in electrical injury, the commonest is a ventricular fibrillation if the current passes through the heart in low voltage current, which is most common. Next commonly is the paralysis of respiratory muscles, that is respiratory muscles, because it passes through the brain stem. The brain stem centers gets damaged and the person dies because of paralysis of respiratory muscles, leading to asphyxial death. And rarely a direct effect on the brain stem as a result of current passing through the head and neck. Then inhibition of respiratory centers, ectothermal injury or ventricular asystole may also occur, where the person may die because of asphyxia or because of heart failure. Secondary cause, where there is complications of electrical injury, there may be infection leading to septicemia and person may die because of septic shock. Postmortem findings. To confirm the person died because of electrical injury, the examination of scene of crime is very important, which gives a clue regarding tools, appliances or machinery involved in the incident. Examination of entire body is very important, particularly the hands, especially the fingers, along with examination of the feet and shoes for evidence of electric burns is of utmost importance, since the current to pass, there should be minimum of 2 injuries should be present, entry and the exit wound. So examination of all the limbs, toes, fingers has to be examined to identify the entry and exit wounds. Externally, the face is pale, eyes are congested, pupils are dilated, petechiae are seen, eyelids and conjunctiva. Usually the signs of exposure present. Rigor mortis appears early because of passive current, the contraction will be more. There will be postmortem staining will be dark red in color, dark blue red in color. The jaw bones at the site of entry is diagnostic present. So presence of jaw bones at the entry wound is a characteristic if it's found, that is puckered up, raised edges with puckered depressed areola with no reddening or no area, there is no reddening, which characteristic jaw bone is present, then it is diagnostic of electrical injury. Internally, again, signs of asphyxia, that is petechial hemorrhages, congestion of organs and cyanosis is typically seen. In lungs, it will be congestion edematous. Heart will show focal necrosis with variable hemorrhage and acute contractile bands will be present. In brain, meninges and pancreas organs are congested. Petechial hemorrhages may be found along the line of passage of current. So as the current passes through the body, a petechial hemorrhage may be found like under the endocardium, pericardium, pleura, brain and spinal cord. Now coming to medical aspects of electrical injury, deaths are usually accidental. The commonest is accidental. Suicides are rare and homicides are even rare, causing the homicide. So death by homicide by electrical injury is very rare, since many protections are available in home household, where if the current is passed, sometimes there is a stoppage of current is present in the protections are available in household organs household, and causing homicide by electrical injury is very rare. Suicide is again rare. Iatrogenic accidents may lead to charge off in case of negligence if the during resuscitation, if the current passage is more and the person may die, maybe the doctor may lead to death of the person. During CPR formation, if the electricity is more current is formed without proper care is taken. Traumatic injury may be sustained from electric shock itself from electroconvulsive therapy in treatment of mental disorders. There may be during electroconvulsive therapy when the current is given to for treatment purposes, sometimes traumatic injury may also occur. It is not possible to differentiate between antemortem and postmortem electrical injury. So, if the person has been killed and later on electrocution is done, it is very difficult to differentiate between antemortem and postmortem electrocution, since there is no edema, there is no redness seen. Next medical importance is judicial execution. Though not followed in India, in certain countries like in USA, the electrocution, that is the capital punishment in US, is the electrocution where the person is made his death sentence is passed. The condemned man is strapped on the wooden chair and one electrode is put on the shaved scalp and another on the right lower leg. Then AC current about 2000 volts and 7 amps is passed for 1 minute through the body, and same current is passed again to the body for second time for 1 minute, so that the person gets electrocuted and that sentence is passed by this method. So these are my references. Thank you.